Okay, welcome everyone. As many of you probably have presumed, my name is Brooks Bonner. I am the Director of Community Engagement and Enrollment Management here at the Organization for Tropical Studies. This is the pre-departure orientation for global health issues in South Africa for summer 2019. So hopefully you're in the right meeting room. If you're not, then yeah, I guess leave now, or hang on and learn some great information about this awesome course that's going to be happening here in less than a month. So what I thought we would do is myself and then Anna Versfeld, who's actually going to be the lead faculty member. You can see her video is on there. She is going to be joining us here today. And what I thought we would do is I would give a quick introduction for myself as well as her. And then we'll do a quick round of introductions for you all as well. So if you have video access, you can turn it on when it's your turn. But first off, again, my name is Brooks Bonner. I work here at the Organization for Tropical Studies. I have worked here for a little bit more than almost 4 years, working with all of our study abroad programs, mostly our undergraduate programs. So I have a background more in international conservation and sustainable development. Spent some years in Latin America as well as in the Peruvian Amazon, working on community-based conservation efforts. So I'm bringing that expertise to the field of undergraduate study abroad. Let's see. It looks like Anna is having some trouble with her microphone. So what I might do then is pass off the introductions to the students. So what we'll do is just say your first and last name, what your home institution is, maybe what your major is, and then what you're most excited about or looking forward to with the Global Health Issues course in South Africa. So let's see. Let's start with the first person I see on my list, and that would be Laura. Laura, I will unmute you. Laura, are you there?
I am.
Great. Do you have if you have video, I guess you can turn that on if you like.
I don't know how to do that.
That's okay. That's okay. Let's see. I think I might be able to do it for you if it's okay.
That's okay. Okay. Hi.
There we go.
I'm Laura McCord. I attend Auburn University at Montgomery in Alabama. My major is biology with a concentration in pre-med, and I'm just really excited to just see a different country. I've never been outside of the United States, and just to see how their culture works and just stuff about global health. I'm really excited. So
great. Nice to meet you.
Nice to meet you.
In person, yes. Okay, so let's I'm gonna mute you there, Laura, and let's move on to let's see. I think Monica, are you there?
Yes, I just figured out the audio thing. Sorry.
That's okay. I had everyone muted, so there was to be less background noise. But
sorry.
That's great. I did that to everyone, not just for you. So yeah, if you want to give a quick introduction, that'd be great.
Okay, so I'm Monica Stevenson, and I'm originally from Colombia. I've been to the US for about almost 8 years now, and I am transferring to Ohio State University in the fall to pursue a degree in environmental policy and decision making. And I don't know anything else.
Just something that you're most excited about or more interested in learning about in this course.
Oh, I want to work with policy, so I thought it was very interesting that this course was going to offer kind of like how policies affect the social and environmental kind of like arrangements of a given group. So I don't know, I'm very curious to see how those kind of like how the government facilitates or neglects certain populations, I would say.
Excellent. I think you definitely get a chance to see how that happens in South Africa in this course for sure. Yeah. Thanks for joining us. Okay, so If you wouldn't mind muting yourself, or I think I can mute you there. There we go. And then I have someone that is called in from a 513 area code. I'm going to unmute you. I'm not sure who is on the line.
Hi.
Hi.
My name is Sydney Simpson. I attend Spelman College. I'm a biology pre-med major, and I think I'm most excited to just learn about the medical world in the healthcare system in a different country other than the U.S.
Great. Thanks for joining us, Sydney. Okay, so let's move on to, let's see, Tiana, are you there?
Yes, I am.
Okay, welcome.
My video here.
Sure.
Hi, my name's Tiana. I just finished my sophomore year at Washington University in St. Louis. I'm a chemistry major, and I'm also pre-med. And I think what I'm most interested in is I'm really interested in learning about rural health and healthcare in underserved areas in the US even. And so I'm interested to see how in a different country like South Africa, the disparities there between like the urban and rural healthcare systems.
Excellent. That's definitely a focus of the course. Looking at kind of the healthcare assets across the kind of the spectrum of urbanization. So
yeah, I'm excited for that.
Excellent. Thanks for joining us. Okay, let's see who else has not spoken yet. I think Vanessa, are you there?
Yeah.
Okay, we can hear you. Go ahead.
Okay. Yeah, did that work?
Yes.
Okay,
Hi.
I'm at Starbucks. If it's loud, I apologize.
That's okay. We can hear you.
Okay, I'm Vanessa. I'm a biology major at the University of Nebraska-Lincoln. And I'm also pre-med as well. So what I'm most interested for is probably just to go to a new country that I've never been to before and to see all those kinds of cultural differences in the lifestyle and how that affects the healthcare there and different things you see with that. So yeah.
Great. Thanks for joining us. Okay, let's see who else. I think Yunielis, are you there?
Yes, I'm here.
Yeah, great.
So I'm Yunielis Clemente from University of Puerto Rico, here in Puerto Rico. I'm doing my bachelor's degree in environmental science, and I'm really excited to be in the class and see a new country that I haven't been in and see how this organization actually helps with the environmental and healthcare or health problems in this country.
Great. Fantastic. Thanks for joining us.
Thank you.
Okay, let's see here. I think that might be everyone. I'm hoping, let's see, Anna is back. Anna, can you hear us okay? I can see you, but I can't hear you. Okay, well, let's see. She's gonna give us 2 minutes to restart. I think log back out maybe and log back in. So in the meantime, what I can do is kind of go over a little bit of how the airport pickup is going to go. I know some of you have had some questions about whether you should, what you should do if you arrive a day early or the day you arrive, at what times are okay. Be sure to share with us your flight itinerary. So I'm gonna send out an email, I think probably today, that's just gonna ask for your arrival airline, the flight number, the date, and then the time of expected arrival. And then as well, make sure you share your departure information as well. So that's gonna allow us to track your flight. If for some reason it's delayed, we'll know that, and we'll have someone at the airport there to pick you up. Generally, we will have someone at the airport to pick you up. You want to make sure that you wear your OTS t-shirt that hopefully some of you have received or will be receiving. That's going to be the easiest way for us to pick you out in a crowd. But we'll be basically be waiting once you go through customs. It's a fairly straightforward. Shouldn't have any issues there since it's just the 30-day program. But once you get out of customs, you'll see someone there from OTS, and you should be able to be recognized right away. So it sounds like maybe Anna's microphone is working now.
How's that?
That's great.
Yay.
Yeah.
Sorry. Every time I have a big meeting, this happens to me. I recently had a huge big interview and it did the same thing. It's just mean. I'm really pleased to meet you all. Thank you so much for being here today. Yeah, I'm Anna Fassfeld. I am a medical anthropologist. So I look at health systems and cultural systems relating to health. My specialization is in key populations. So that's people particularly affected by certain diseases and tuberculosis. But I've also worked with HIV, I've worked with hepatitis C, and I essentially mostly actually consult in South Africa on designing and implementing research, and I also do some international consulting on how we understand local health systems. I haven't taught a course like this for a while, though I've done many in the past, and I'm really looking forward to having a month with you all.
Great,
yeah.
Great. Thanks, Anna. I'm wondering if you could talk a little bit more, or maybe speak a little bit about some of the details of the course, in terms of what the focus will be. I know we can talk a little bit about kind of where the group will be going in South Africa. I'm sure all of them, it's probably their first time going to South Africa. So kind of wrapping their head around where they'll be going is going to be helpful for them as much as it can be, I guess, until you're there. But I wonder if you could talk a little bit more about that.
Sure, I can. You also got a little bit of noise in the background because I have a little person who's actually joining us on the trip. So you'll probably hear her now, and you have her for a whole month, so you might as well get used to it. Though she does come with a nanny. Right, so we're going to start in Johannesburg, which is our biggest city, and we've got 4 days in Joburg. And we're really going to start by just orientating you to the country, a little bit to the continent, mostly to the country in terms of pre-colonial history and colonial history and apartheid, which was our political system, which we came out of 25 years ago, but which really still sets the scene for the fact that we're one of the most unequal countries in the world, and that disparity really comes across in our health systems and in people's health and the way that they live their lives. So we start off with our time just getting ourselves used to the context, understanding where we are, and then also introducing you to the concept of global health, which is actually not a very old concept. We sort of moved from this concept of public health, which was something countries did, to the idea of global health, which is something that is we're an interconnected world, and we're all responsible for the way that the health in a country functions. So we are in Johannesburg. I'm scrolling as I talk, so apologize. I'm sort of just looking. We're in Johannesburg until the weekend. We're going to end that with going to the theatre, going to one of the oldest theatres in South Africa. It was an apartheid resistance theatre, and we're going to see a show about the murder of somebody who's basically called the architect of apartheid. So it's very much an orientation period. We are then moving off, and our second theme I'm calling knowledge production. And the idea is really that the way we understand the world shapes the way we produce knowledge, which shapes the way we know the world. So it becomes a cycle of knowing. And so we're going to look at that, and within that we're going to look at how to do research. So a lot of you come from the sciences. My specialization, I also do work with quantitative research, but my specialization is qualitative research. But we're going to look at the ethics of research. We're going to look at the basics of quantitative research, the basics of qualitative research, and what we call participatory research. And at this point, we're going to start helping you to design your research proposals, which is one of your deliverables for the course. And so we've got a couple of days of just setting that up, and then we send you off on your homestays. And this is 2 nights. I think I'm correct, 2 nights, where you go and stay with families in the area. I didn't say that this is in Hamakuya, which is an area in the northwest of Limpopo. It's a very rural area. It's very beautiful. But part of what you're going to be doing is staying with families and really getting to understand what life is like every day. And part of your project there will be thinking about how people access healthcare from where they are. So that's our time in Hamakuya. It's roughly a week. You end with a day off. And then we go up to Bits Rural, which is in the northeast of that province, same province, and it's the rural facility of the University of Witwatersrand. And I haven't actually been, but I do hear the giraffes walking past the window, so that's quite fun. I'm looking forward to it myself. We spent this week looking at health through the life cycle. So we're going to start off with the key issues that the first 1,000 days that are in the first 1,000 days of life, and then we're going to look at sorry, hold on a sec. Is the background noise too much?
No, it's not too much. We can hear it a little bit, but it's fine.
Okay, fine. So we're going to basically start off with looking at the first 1,000 days of life, and then we move on to looking at waterborne diseases, which is the key killer of children under 5. And then we're going to look at malaria, which is the biggest killer in Africa as a whole. And we move on to looking at tuberculosis and HIV. And we end up with looking at non-communicable diseases. So essentially, I'm taking you through the life cycle, and we're looking at that which affects people the most at certain ages. And we have a number of site visits during this period. So you'll be going to visit a malaria eradication project. You'll be spending a couple of hours with what we call home-based carers or community health workers, who really are the backbone of public health service in this country. You'll be spending a couple of hours with an effective health NGO to see how that works, because nonprofit organizations carry a lot of healthcare in South Africa. I think that's it. I'm trying to talk without reading the program. I think that's it for that week. And then we are moving on from Hamakuya to Skukuza. Hi, Lawrence. I see Lawrence has joined us. And our Skukuza time, we're essentially going to look at the key issues at the moment that are just starting to really come to the forefront of climate change and ecological collapse and what this means for health. And you will have some time there to research that yourselves and to do a presentation on it. And then you will really move on to, we'll also be having a day with Lawrence, where you're going to be doing an ethnobotany walk. And you're going to have quite a lot of time for reflection and thinking and work on your own during this period. And that's essentially it. We wrap up after our week in Kruger. But you'll have the last couple of days of quite slow time to work, and we'll work with you in developing your projects.
Awesome. Thank you, Anna. That was very helpful. I like that Lawrence came on just as you were finishing, so he made you do all the real hard work. But Lawrence, maybe you could give a quick introduction of yourself. We had the students give intros. Anna and myself gave an introduction of ourselves, but maybe you can get an introduction of yourself, what your role is with the program, with OTS, and anything else you want to share, tire blowout stories, anything like that.
Rather not. Hi, everybody. Sorry for the delay. I had a rather typical challenge in the Kruger Park. We ended up with a flat tire in the middle of the bush. And so just had to quickly change that. So I'm here sweaty and flustered. But that's actually a great introduction for what you guys might well experience. My name is Lawrence Kruger. I am the director of the OTS South Africa programs. and have been involved with OTS for some 16 years. I think we've now run 30 ecology programs and 11 global health programs. So field-based education is certainly our thing. And what it is that we most want to achieve with you guys over the next, or certainly next month, is you guys get some of the best possible education back on campus, theoretically speaking. What we can offer in this program is contextualized field-based learning. Anna has some substantial experience in our medical world in South Africa, our public health world. And our jobs on this program with Anna and all the various academics and the other logistics staff that we're working with, all experts in the field, is to render all that theory alive in the field. So I'm sure Anna's mentioned the sites that we're visiting, but these are all carefully chosen sites that exemplify some of the challenges, but also the opportunities that people face in South Africa around access to health. And also, you will also gain experience in a whole range of other subject matter. But the idea is that you guys leave South Africa in better shape we found you. And what you're going to try and do with you in this almost a co-learning philosophy of field-based education is we're going to take you to these various sites and ensure that you get a clear understanding of what the main challenges people in those areas might face. You think about the urban center of Johannesburg, the deep rural areas of Hamakua, the peri-urban areas of Acorn and then ultimately the conservation area that is the Kruger National Park. Anna has outlined all the key elements of the academic program and the academic journey that you'll be on. But I guess for me, it's also about telling you a bit about the practical side of things. So as I said, you're going to be experiencing this a range of sites across an urbanization gradient. And we're going to try and focus on the key emerging challenges that we face as some of the global problems, but also the South African context for those. My particular field of expertise would be the world of ethnobiology. I study savanna trees and forest trees. I'm interested in how they survive in the face of disturbance in the form of elephants and fire, but also from harvesting by people. And there's, if you think about ecosystem services and the value of naturally harvested food and medicines, it's important that we also develop an understanding of how these might impact the plants. And so this world of sustainable harvesting, cultivation of medicinal plants. We work closely with a Sangoma just outside of the Kruger Park, who has spent most of life dedicated to growing medicinal plants. So my realm really is the ecological and conservation realm, which includes people and of course includes their health. And then lastly, my job, along with Anna's, is also to make sure that this experience is entirely rewarding. So it's got to be fun. We take you to some incredible places, but to also have a lot of fun along the way. We play a lot of sport. We ensure that you engage meaningfully with the various communities that we visit. But also, once you get to the Kruger Park and you start diving into the world of environmental health, you will also spend time walking in the Kruger Park with experts in the field, with carrying rifles to keep you safe. We'll go on game drives. And we want to make sure that you have a well-balanced experience in South Africa. So there it is in a nutshell.
Thank you so much, Lawrence. Great intro. Great overview of the course. Glad you made it safe. Sorry about the tire blowout. Hopefully everyone was okay.
Yeah, just me, all good.
Excellent, excellent. Okay, so I think at this point we would like to open it up to the students to ask any questions. I know some students, a lot of students have, worried about, money to bring or what to pack, what to leave at home. So I think this is a good opportunity. If you do have questions in the final, I guess it's 11 or 12 days in your preparation, now is a great time to ask those questions, and we can hopefully guide you on the right path. So if you can, unmute yourself to ask your question, and then we can answer it to the best of our ability.
Hello?
Yeah, Vanessa.
Yeah, so I guess with the money, just how much would you recommend bringing for like what we're going to be spending stuff on? And should we just get that exchanged before we leave, or once we get to Johannesburg, or what's best?
Yeah, so I think, and Lawrence or Anna, you can chime in. No, Lawrence, go ahead.
Sorry about that. Vanessa, it's very easy. So when you land, what we'll do is we'll meet you at the airport, and the first thing you're going to do is phone your folks and let them know you've landed. The second is you need to get an international adapter because they're very cheap in South Africa. And the third, you probably draw around $100 from the ATM, accepting no help from any strangers whatsoever. And you know, $100, that's about 1,400 Rand. That'll cover all your snacks and the tips that you leave for the cleaning staff, maybe some presents you want to get for folks back home. But we usually find about 1,400 Rand, so $100 should be absolutely adequate. We cover all your costs. Your fees obviously cover your accommodation, your food, and the only thing you really need to buy would be your drinks and snacks. As I say, wherever we go, people clean our toilets. When you get there, the place is spick and span. The toilets are clean. They're going to clean up after you. They usually clean, during your stay there. So we just out of a recognition for the efforts, we do leave cash tips, and that's usually about 5 Rand per person a day. So what? That's about 40 US cents, but it all adds up. Then presents for your folks. You can use your credit card in most places. Hamakoya, you will not find anywhere. That's deep rural areas. You won't really use your credit card there, but once you get down to Acornhoek and to the Kruger Park, and obviously around Johannesburg, most places do have credit card facilities, and you can purchase presents or whatever you wish by using a credit card as well. So I think when you get to the airport, we'll be there to meet you. We're on hand just to take you to the ATMs and so on. And I think $100 will cover you for your duration, unless you have this deep-seated passion for biltong, which is South African beef jerky, and you need to buy a kilogram or 2 per day, in which case it becomes very expensive very fast.
And I also would say, thanks, Lawrence. I would also recommend to all students to make sure that you notify your bank that you will be traveling, so that you don't try to purchase something or get money out and there's a fraud alarm put on your account. So make sure that you notify your bank, let them know that you'll be traveling, what dates, and where you'll be going. You'll be in South Africa, and that'll hopefully help avoid any issues with that.
Awesome, thank you.
Can I add in there?
Sure.
So just so that you know, there will be ATMs along the way too, right? So if you find you've run out of cash, especially on the travel days, there will be, at petrol stations, gas stations, there'll be ATMs. In the very rural areas where there are no ATMs, you will struggle to spend your money anyway, so you'll be fine. Anyway, you can spend your money, there will be an ATM close enough.
That's a good point. That's a good point. Okay, other questions that are out there? I'm sure you have them.
Can you hear me?
Yes, Laura.
Okay, so my question is,
Laura.
Excuse me.
Yes.
If we're flying in a day early, is one of the OTS people still going to come get us, or do we need to figure out how to get to our hotel ourselves?
Yeah, so if you're sorry, Lawrence, go ahead.
No, sorry. Oh, okay. Laura, we'll be on hand to fetch you. The second you hit the ground in South Africa, I'll be holding an idiot board saying OTS on it, so we'll be hard to miss.
Lawrence,
okay.
that's for a day early as well? Just want to confirm.
We'll be in Johannesburg at the time. And yes, we could certainly be on hand to, if anybody's a nervous traveler and they like, if they arrive the day early and you guys would like us to meet you there, I can certainly do so as well.
Yeah, that's why it'll be important once this is done to make sure that you share your flight itinerary so that we know when you're going to arrive, and then if your flight gets delayed, we know that when that your new arrival time will be.
Okay, and then one more question. So since I'm flying in a day early, I got a room at the hotel that was mentioned in the email that you sent out, Mr. Brooks. So will y'all be able to take us to that as well? Yes, okay, awesome, thank you.
So Tino and I will be staying at that same place. So no problem, you'll be with us.
Okay, thank you.
Absolutely. Okay, other questions that are out there?
Can you hear me?
Yes, Vanessa,
Yes,
go ahead.
Okay. I know in the orientation packet it says to bring your laptop or computer or tablet or something. Is that still recommended? That makes me a little nervous, but if we need it, I'm totally willing to bring it. I guess I just want to know.
Oh, Anna, I think you're muted.
Sorry. You'll have work to do. So, I mean, Lawrence, you fill in, but you're going to have a research proposal to write. You're going to have case studies to write. So you will need, and also your readings. A lot of your readings will be on, will be soft copy. So you do need something to do those on. Carrying them with you shouldn't be a problem. We'll give you guidelines early on how to take care of your things as you go to.
But yeah, I would agree. I would suggest if you have one, I would say bring it. I think will help with your workload.
So aside from the academics, you'll be taking a ton of photographs, and you probably want to download those. If safety is your concern, we yet to have any problems with theft in the sites that you'll be visiting. So if you are away with on a field trip in Johannesburg, the lodge is entirely safe. Zulu Trust is remarkable. Students leave their laptops in their tents, and we've never had a problem there. Virtual facility, you can lock it up. Skukuza, oh well, if anybody wants to come and steal anything, they'll get eaten. So we're okay. So theft hasn't been really much of a problem. But I think what is a challenge though is just looking after your machine and not dropping it, and so generally speaking, being mindful of your own equipment. Yeah.
Vanessa, does that answer your question? Does that help?
Yes. Thank you.
Great. Okay, other questions that are out there? Concerned about how many pairs of flip-flops to bring, things like that. If you do forget something, don't worry so much. I mean, you can buy, toothpaste, toothbrush, deodorant, those types of things will be obviously easily accessible, readily accessible in Johannesburg in the first few days.
Okay, I have one question.
Yeah, go ahead, Laura.
Okay, sorry. For clothes, do we need to bring something like to dress nice in? If that makes sense, like if we're like giving a presentation or something, do we need to be dressed up to do that, or is there anywhere we're going to be going where we need to have like nice clothes?
Yeah, I think it's worthwhile. So you will be giving a couple of presentations, and certainly towards the end of the program in front of an audience. So that's always nice to have slightly smart. A couple of the visits along the way, you might be required to be a little smarter. So I would definitely bring one change of clothing that doesn't have to be a suit, but certainly something a little bit smarter, a collar, slightly smarter slacks, whatever you're comfortable in, but also just not flip-flops and a t-shirt. I do also, since you've raised the issue of clothing, Laura, it does get very chilly. The World Cup soccer that was held in South Africa was the coldest ever. In Johannesburg, it gets to about, it can get down to sort of -3 or -5 Celsius, which is very chilly. It's below freezing. And you certainly want to bring some nice warm clothing for that. Hamakoya is super toasty during the days, and the evenings can be a little bit breezy. When you go on a game drive in Kruger Park, early morning, we wake up before the dawn, grab a cup of coffee, and in the back of the game drive vehicle, so it's a pickup truck with seats on it, and you drive through a riverbed. It gets pretty chilly, so you definitely want to bring something warm. And the sleeping bags that you bring for your home stays will also need to be warm. So not sort of Everest style thickness, but certainly a sleeping bag that will keep you warm at 0 degrees Celsius.
Yeah,
Awesome.
nothing below, I wouldn't say anything below for the American translation, nothing below a 30-degree bag is required. So a standard sleeping bag would be fine.
Okay, thank you.
Sure.
If I could also just quickly take the opportunity to mention that internet and Wi-Fi is relatively limited. Certainly there's no signal, no internet or cell phone reception up in Hamakoya. And down in Witsrol facility, there certainly is cell phone reception, and we have a course modem where for academic purposes, if you need to jump online, you can do so. You can purchase internet for social use and otherwise in Witsrol. And Johannesburg, the Wi-Fi is available but spotty. And in Skukuza, being a fairly remote field station, we have the best in the area, but it's still fairly limited. So just to remind you guys that you're traveling in the rural parts of South Africa and that internet and Wi-Fi is generally speaking quite limited. We have enough for your academic pursuits, and Anna has also developed a strategy around availability of Wi-Fi and internet. But just to please chat to your folks or your partners, just to let them know that cell phone reception will be intermittent. Having said that, we've also got very good emergency protocols. So if one of your family members needs to get a hold of you, there's a whole sequence that you go through. So even in the middle of absolutely nowhere in the north, in the Zulu, your folks say they need to get hold of you for organizing accommodation at university, they can contact our headquarters in Skukuza. They will contact the office in Zulu, and they'll send a driver to come out and meet us. On top of that, I just go up twice a day to go and check any messages, and then I can also pick up any emergencies and get back to you guys ASAP. So if there are any challenges with from home, we can deal with those. And of course, if there are any challenges from your side, if you've slipped and hurt your ankle, and you just want to let your mom know, then we'll also make that work. But just so for any emergencies, no problem with communication. But just to give you the heads up, we choose these sites very carefully. I think there's learning with a Zulu trust, but it's also in an area that's independent of any form of Wi-Fi or cellular. And I think that's a great opportunity to connect as well. So just to give you the heads up that it is quite limited in certain areas.
Thanks, Lawrence. Yeah, that's a good point. That also reminds me of another point regarding prescription medication or any type of medication that you as a student take. Make sure that you're bringing enough for your entire trip, for the entire time that you're in South Africa. Also, make sure, I know it may sound crazy, but we've had students in the past that go on a study abroad trip with us and think, oh, this is great, I can go off my medication, I don't need it anymore, which you can imagine can lead to some issues. So we do want to make sure that whatever your doctor or your physician has prescribed, that you stay on your medication and that you stay up to date with that. It'll make the experience for you as well as everyone around you that much better. If you do have any questions or issues, during the program, we have staff, faculty, professionals that are willing to assist you in any issue that may arise. But we do want to make sure that if you are taking any type of prescription medication, that you bring enough for the entire trip, and that you stay on the amount that your physician has prescribed. Okay. That being said, other questions? Lawrence, go ahead. Yeah.
I was going to say that we have medical assistance close proximity in all the sites, except for Tulu, but there we've got a great system. And if any accident, we have 16 years of experience of managing this, and we'll be able to resolve any challenge.
Great. Okay, last call for questions. Anything also, and I think one other suggestion is make sure that you're completing all of your post-acceptance documents. I should have emailed you if you have any documents that are still remaining. You also should have received an email yesterday from Lori Bellinger at Auburn University Montgomery about another pre-departure orientation. It's really just a slideshow that you got to go through. Make sure that you complete that. You can email her if you do have any questions. Do make sure that you complete that as soon as possible so that we can get everyone prepared to go. And then the last thing, make sure you're sending your flight itineraries to me. I will send out an email reminder once this is done. But that is very important that we have all that information so that we know when you will be arriving and when you are departing at the end of the course. Anna or Lawrence, you have anything else that you want to add? Parting comments? I guess we're about 12 days until students' arrival.
My only comment, and I can't see if you unmuted or not, but is it's going to be a fun experience. It's going to be a challenging experience. Both Anna and I feel that the best learning comes when you're out of your comfort zones. And so we have prepared, or Anna's prepared a course that will challenge you in many ways, but also hopefully stimulate you. And you're certainly going to leave South Africa with much broader perspective on global health. But I know that sometimes your folks are a little bit concerned. So if there are any parents, they're a little bit nervous. I've spoken to countless parents about their experiences here. They're welcome to reach out to me. My contact details are on the web, or you can just contact me via Brooks. So if there are any nervous folks out there that just want to have a word about anything, I'm certainly happy to do so, just to allay any fears. But mostly come with an open mind and be prepared to have a lot of fun, but be prepared to be challenged and be prepared to engage. There are going to be a lot of people interested in your being here, and you're going to bump into a lot of fascinating people. And we'd love you to take full advantage of that. So come with your curiosity. And musical instruments.
And running shoes.
Yes.
Can you hear me? So just the last thing from me, you are going to get a detailed academic program, which you'll get early next week. There is some pre-reading for you to do, and there will be reading for you to do consistently through the course, and we have put time aside during the course. But I recommend that you start start with what you can. We'll make all the readings available to you. And certainly do as much of the pre-reading as you can before you get here, so that you have time to just be here when you are here. Yeah.
Great. Okay, thanks so much. If there's no other questions, you can feel free to email myself, or I'll be sharing Anna and Lawrence's emails as well. But yeah, please send in those documents that are still pending, and we'll see everyone soon. Thank you. Thanks, Anna. Thanks, Lawrence.
Thank you. Bye.
See you guys.